So let us now discuss the next classification, that is the anticholinergics and the prostaglandins, right guys? So I'll talk about the mechanism of both the classification together in the later part of the video. But first I'll try to cover the introduction part and the adverse effect of both the classifications. Okay. So let us start with the anticholinergics. So the first point is that the anticholinergic drugs, they inhibit the action of the acetylcholine, that is it's a chemical messenger and is also called as the neurotransmitter. So guys, basically what happens that the neurons, they release some chemicals, okay, and that chemicals transmit the nerve impulses. So what happens that these drugs, as you can see here, they basically interfere with the mechanism and the action of the acetylcholine, okay, and that is how the amount of ACL is reduced. I'll talk about the mechanism in detail, so don't worry, right? This is the introduction part. Now let's talk about the adverse effect. First we have is a xerostomia. That means the patient complains of dry mouth. That is a xerostomia. Okay. So next we have the dizziness. That is the patient often complains of having a feeling that he or she would get faint. So I may write the dizziness means the feeling of getting faint and the body is weak and also feels like that it is unbalanced. That is the meaning of dizziness. Okay. Next we have is the prostaglandin, right guys? So these are natural chemicals produced in the body and these were first isolated from the prostate gland. That is how the term prostaglandin was given. Okay, and now what we do, we synthesize them in the laboratories, okay, for our own medical purposes. So we say that these are synthetic medications used to treat the stomach ulcers, that is a break in the tissue surface or a mucosal lining, and it's also used in treatment of bleeding disorders. That is the first point. So next we have that it is often taken with the NSAIDs, right? So guys, this is a very important point and we'll have to understand this as well. So we'll talk about it later, okay? So next we have is the adverse effect, and then the first we have is the uterine contraction, that the excess amount of prostaglandin infiltration in the body will cause uterine contraction, which is an adverse effect. But in some cases, that is in a pregnant woman, it is also used to induce labor. So we may write that it induces labor in pregnancy, which is a use of prostaglandins. Okay. Right. So next adverse effect is the diarrhea. So as you know, diarrhea means there are watery stools. Okay. So the stools here are watery and they are loose. So we may write these are watery and these are loose. Okay. In a liquid form. Okay guys. Right. So we've completed the introduction part and the adverse effect. So now let's talk about the mechanisms of both the classifications. Let us have a quick revision on what we discussed in the earlier videos about the proton pump inhibitors and the H2 antihistamines, right? So in that video I discussed that we have a gastric parietal cells, okay? These are the parietal cells, and these parietal cells have 3 receptors which stimulate the release of HCl production in the stomach lumen. So one of the receptor is called as the gastrin receptor. Then we have is the histamine, that is the H2 type receptors, and also we had is the acetylcholine receptor symbolized as ACH. Okay, so to understand the mechanism of the anticholinergic, so guys, we have to first differentiate between 3 terms. First is the anticholinergic, then we have is the cholinergic, okay, at last we have is the acetylcholine, also symbolized as ACH. Okay. So guys, let us try to understand this. Let us assume we have a neuron here and this is the receptor part, right guys? And the neurons, as I told you, that this is the terminal end and the chemical messengers or the neurotransmitters are synthesized in the terminal end of the neurons, okay? So let us say this becomes the neurotransmitters like this, okay? So guys, on the basis of what type of chemicals are released by the neurons, we can have a classification of the neuron as well. That is, if the neurons, they release adrenaline as the neurotransmitters, so we say this type of neuron releasing adrenaline is called as the adrenergic neurons. Very simple, adrenergic neuron. If the neuron is releasing acetylcholine, then that type of neuron is called as the cholinergic neuron, okay? And the system which includes this type of neurons is called as the adrenergic system, and in this case we'll say this is the cholinergic system. right? That means this system includes the neurons which releases the acetylcholine, and this includes the neurons which releases the adrenaline as the neurotransmitters. Okay. So now let us assume that here the transmitters that are released is the acetylcholine. Okay. So I may write like this, that the neuron is here, okay, and the chemicals are released, that is the neurotransmitters which are the acetylcholine here, right? So guys, now the question arises that the brain sends the signals to these neurons to stimulate the release of the acetylcholine. How? So let us understand that also. So for example guys, we have, let us say we have the brain, okay. Now the brain has to send the signals to these neurons. How? You know that the brain sends the signals via the nervous system, and in nervous system we have the two classification, that is, one includes the central nervous system, other we have is the peripheral nervous system, right? That means the neuron present in the brain and spinal cord, and the neuron present outside the brain and spinal cord is the peripheral, right? In the peripheral guys we have two, that is the ANS which becomes autonomic, and then we have is the somatic, right? In the ANS we have two classifications again. So one includes what we call as the PNS, and one is the SNS. So this is basically a parasympathetic, and this becomes a sympathetic, right guys? So this is basically nothing but the cholinergic system. Another name of parasympathetic is the cholinergic system, and these are the adrenergic system, right guys? Now the PNS system, that is the parasympathetic or the cholinergic system, they transmit the nerve impulses, okay, that these neurons are present, that is, this is the cholinergic neurons, and these are present in the cholinergic system, okay, and the nerve which carries the signals is called as the vagus nerve, which is a cranial nerve, right? So remember that the brain sends the signals to the neurons, that is the cholinergic system neurons, by the help of the vagus nerve, okay. So let us say the neurons releases the acetylcholine, okay, and here we observe that there is the binding of the acetylcholine like this. So once acetylcholine is binded with its receptor, as I told you that the histamine binds with its histamine receptor, that is the counterpart. Similarly, the acetyl will bind with its counterpart, that is the acetylcholine receptors. So now what will happen? There will be the opening of the calcium channels, and the calcium channels will cause the influx of the calcium ions in the gastric parietal cells. As simultaneously what will happen? There will be the increase of calcium ions in the gastric parietal cells. So if I talk in detail, in the H2 antihistamines, what we observed that when the molecules they bind with the H2 antihistamine receptors, so what happened? That the ATP converts to CMP, right? The CMP increase in the amount. So we say in the H2 antihistamines there is increase of CMP concentration, right? So in the gastric parietal cells we have what is called as the CMP increase and the calcium increase, and this gastrin also guys, this also causes the increase of calcium ions, right? So we say we have two type of secondary messengers which increase in the amount in the gastric parietal cells. One is the increase in calcium ion, and one is the increase in CMP concentration, right? This is caused by your acetylcholine receptors and the gastrin receptors. This is caused by the H2 antihistamines, right? Now guys, whatever the increase may be, this both will activate the protein kinase enzyme. Now I talked about in the earlier video that this protein kinase enzyme are the ones that stimulates or starts the action of the proton pumps, right? That is the proton pumps. So let us say we have the proton pump here. This becomes a proton pump, okay. Now as the level of Ca increases, what will happen? It will activate the protein kinase enzyme, that is here we have is a protein kinase, and that will cause the activation of the proton pumps, and the HCl ions inflow will occur, and the increase of HCl will be observed in the stomach lumen, right guys? Very clear? So let us say that this release of acetylcholine from these neurons is not in a sufficient amount, okay. So if that happens, then definitely there will be no calcium influx, there will be no activation of the protein kinase, and the amount of HCl will be decreased. So what we can do is we can use some drugs called as the cholinergic drugs. That is, this drug basically what they do is they increase the amount of acetylcholine released from the cholinergic neurons. So once they increase the amount of acetylcholine, so simultaneously what will happen, that more calcium will come into the gastric parietal cells, and subsequently there will be the activation of the proton pumps, and the amount of HCl will be increased. So the cholinergic drugs, they basically increase the amount of HCl in the stomach lumen, right? But what about the meaning of anticholinergics? So guys, anti, you know, that is has an opposite effect. So in this case, the anticholinergic basically oppose the effect of the cholinergic drugs, right? That means they somehow decrease the amount of HCl production. How they do? So let us see here. We have the anticholinergic drug. Now it blocks the acetylcholine receptors site and prevent its action. So now these drugs, let us suppose this becomes the anticholinergic drugs. They come here, okay, and they basically block the ACH receptors, right? So once the anticholinergic block the receptors, so definitely the acetylcholine here released will not bind to the receptors of ACH, okay, and there will be no calcium influx ion, no activation of protein kinase enzyme, and amount the HCl will be decreased in the stomach lumen, right guys? Normally what we see that the acetylcholine, okay, they cause the release of HCl secretion, right? And if we give the cholinergic drugs which mimics the acetylcholine, so that causes the increase in the HCl secretion. As you know, the cholinergics, they increase the release of this acetylcholine chemicals from the transmitters, right? Again, if I give the anticholinergic, that is the opposite effect. So what we observe, that this block here receptors, and obviously the proton pump will be offed, right? And this will cause a decrease in the HCl, and also this drug decrease the gastrointestinal motility, right? So they bind with the acetylcholine receptors, okay, like here, and they cause the inhibition of the GI motility and the gastric acid secretion. That is clear, okay? That's all about the mechanism of the anticholinergic drugs. Guys, we have three receptors which stimulate the release of HCl, and we have one receptor called as the EP3 receptors which cause the decrease of HCl production. How? Let us suppose this is the EP3 receptors, right? And we have the prostaglandins here. This is the prostaglandin, okay, like misoprostol. Now this prostaglandin, they come and they bind with the EP3 receptors, okay. As soon as they bind here, what they do is they cause the decrease in the CMP concentration, right? So whatever the factor may be, if the CMP is getting increased, then we have is the release of HCl, or if there is increase of calcium, then also we have the release of HCl. But if the CMP is decreased or the calcium is decreased, then we have is the decrease of the HCl production. In this case, the prostaglandins, they bind with the EP3 receptors, and the amount of CMP product concentration in the gastric parietal cells, that decreases. The protein kinase gets deactivated, okay, and subsequently the proton pump also gets deactivated, and there will be no influx of the H plus and Cl minus ions, and therefore what we see is the decrease in the HCl production in the stomach lumen, right guys? This is the mechanism of the prostaglandins, and therefore the gastric acid secretion is also suppressed, right? So we talked about the mechanism of both the classifications. Yeah, one point that is remaining here is this point, that is the prostaglandin is taken with the NSAIDs. So guys, let us try to understand this also. So guys, NSAIDs means non-steroidal anti-inflammatory drugs. That means those drugs which relieves from the symptoms like pain, fever and inflammation, okay. Next, the prostaglandins, as you see here, has an advantage. Those were, one is that they cause a decrease in the gastric acid secretion. Also, they stimulate the release of bicarbonate ions, okay, and stimulate the release of mucus production. This is the advantage, but it has a disadvantage as well. That is, the intake of prostaglandin will also cause pain, fever and inflammation. So if a patient is having a stomach ulcer, that is, this is the stomach, okay, and the patient complains of having a stomach ulcer in this very part, right? So how can we prevent that? What we can do is, we can simply make a barrier of mucus above this, like this. This is the mucus barrier. And how can we achieve that? If we give prostaglandins, so definitely the mucus production will be increased in the stomach, and it will cause the barrier here, and the stomach ulcer will be treated, okay. So we give the prostaglandins, the treatment of ulcer has been done, but the patient will also complain of having pain, fever and inflammation. So in that case, what we do, we give the anti of prostaglandin, that is the anti-inflammatory drugs, NSAIDs. So if it is causing pain, fever, inflammation, so that will, this NSAIDs will decrease the pain, fever, inflammation, and subsequently this prostaglandins effect will be reduced. And because they release the stimulation of mucus also, so now the ulcer will also be treated. So guys, let us take it otherwise. For example, a patient is taking the NSAIDs in a very high dosage. For example, we can say ketorolac, okay, and the patient is taking in a very high dosage, okay. So what happens, this NSAID basically, they oppose the effect of prostaglandins, right? So the prostaglandin produced in the body, that effect will be reduced, amount of bicarbonate ions get reduced, and the amount of mucus also gets reduced. In that cases, the high amount of NSAID will cause the ulcer here. Okay, now if the NSAID is causing the ulcer here, so how can I nullify this effect? I can simply give the prostaglandin here, and as prostaglandin is given, it will stimulate the mucus production, and definitely the ulcer caused by the NSAIDs will be treated. Okay, so that is all about the mechanisms, right? So now we'll move to the next part, that is the ulcer protective healing, antacids and the anti-H. pylorus.